The profound impact of low testosterone on men's health cannot be overstated. This hormonal imbalance, often underdiagnosed and misunderstood, can have far-reaching consequences that extend into every aspect of a man's life. To truly appreciate the devastating effects of low testosterone, we must delve deeper into the myriad ways it can affect physical, mental, and emotional well-being. Let's begin by exploring the intricate relationship between testosterone and sexual health in greater detail. While the decline in libido is often the most immediately noticeable effect, the impact on sexual function goes far beyond just a decrease in desire. Testosterone plays a crucial role in the physiological processes that enable erections. It stimulates the production of nitric oxide, a molecule that helps blood vessels dilate, allowing for increased blood flow to the penis. When testosterone levels are low, this process is impaired, leading to difficulties in achieving and maintaining erections. Furthermore, low testosterone can affect the quality of erections, even when they are achievable. Men may experience less firm erections or a reduced ability to sustain them throughout sexual activity. This can lead to a cycle of performance anxiety, where the fear of erectile failure further exacerbates the problem. Over time, this can result in a complete avoidance of sexual situations, causing significant strain on intimate relationships and a man's sense of self-worth. The impact on sexual health extends to other aspects of male reproductive function as well. Testosterone is crucial for sperm production, and low levels can lead to a decrease in both sperm count and motility. This can result in fertility issues, which can be particularly distressing for men looking to start or expand their families. The emotional toll of infertility can be severe, often leading to feelings of inadequacy, guilt, and depression. It's important to note that the relationship between testosterone and fertility is complex, and in some cases, exogenous testosterone replacement can actually further suppress sperm production, highlighting the need for specialized care when addressing fertility concerns in the context of low testosterone. Moving beyond sexual health, the effects of low testosterone on body composition are equally significant. Testosterone is a powerful anabolic hormone, meaning it promotes the building of muscle tissue. When levels are low, men often experience a gradual but steady loss of muscle mass, a condition known as sarcopenia. This loss of muscle isn't just an aesthetic concern, it has profound implications for overall health and functionality. Muscle tissue is metabolically active, meaning it burns calories even at rest. As muscle mass decreases, basal metabolic rate declines, making it easier to gain fat and harder to lose it. This shift in body composition can lead to a cascade of metabolic issues. Increased body fat, particularly visceral fat that accumulates around the organs, is associated with insulin resistance, which can eventually lead to type 2 diabetes. The combination of reduced muscle mass and increased fat also puts additional strain on the cardiovascular system, contributing to hypertension and an increased risk of heart disease. The loss of muscle mass and strength associated with low testosterone has significant implications for physical performance and quality of life, especially as men age. Reduced muscle strength can make everyday tasks more challenging, from carrying groceries to climbing stairs. This can lead to a decrease in physical activity, which further exacerbates muscle loss and fat gain, creating a vicious cycle. In older men, this loss of strength and muscle mass significantly increases the risk of falls and fractures, which can have devastating consequences for independence and long-term health. Bone health is another critical area impacted by low testosterone that deserves more in-depth exploration. Testosterone plays a vital role in maintaining bone density throughout a man's life. It does this by promoting the activity of osteoblasts, the cells responsible for building new bone tissue, while inhibiting osteoclasts, which break down bone. When testosterone levels are low, this balance is disrupted, leading to a net loss of bone density. This loss of bone density can progress to osteoporosis, a condition characterized by fragile, porous bones that are highly susceptible to fractures. While osteoporosis is often thought of as a women's health issue, it's a significant concern for men with low testosterone. Hip fractures, in particular, can be life-altering events for older men, often leading to loss of independence, decreased quality of life, and even increased mortality risk. The cognitive effects of low testosterone are an area of growing research and concern. Testosterone plays a role in various aspects of brain function, including memory, spatial ability, and verbal processing. Men with low testosterone often report difficulties with concentration, memory recall, and mental clarity. This cognitive fog can impact work performance, personal relationships, and overall quality of life. Recent research has also suggested a potential link between low testosterone and an increased risk of neurodegenerative diseases, such as Alzheimer's. While the exact mechanisms are still being studied, it's thought that testosterone may have neuroprotective effects, helping to maintain brain health as we age. This adds another layer of long-term health concerns associated with chronic low testosterone levels. The mental health implications of low testosterone extend far beyond just mood swings or irritability. The hormone plays a crucial role in regulating neurotransmitters like serotonin and dopamine, which are key in mood regulation. When testosterone levels are low, the delicate balance of these neurotransmitters can be disrupted, leading to an increased risk of clinical depression and anxiety disorders. Depression associated with low testosterone can be particularly insidious, as it may not always present with typical symptoms. Men might experience what's sometimes called male-type depression, characterized more by fatigue, irritability, and loss of interest in usual activities rather than sadness or tearfulness. This can make diagnosis challenging, as these symptoms might be attributed to stress or aging rather than a treatable hormonal imbalance. The impact on mental health can create a downward spiral in overall overall well-being. Depression and anxiety can lead to social withdrawal, decreased physical activity, and poor dietary choices, all of which can further lower testosterone levels and exacerbate physical health issues. This interconnectedness of mental and physical health highlights the importance of a holistic approach to treating low testosterone. Sleep disturbances associated with low testosterone warrant further discussion. Testosterone plays a role in regulating sleep patterns, and low levels can lead to insomnia and poor sleep quality. Conversely, sleep deprivation can further suppress testosterone production, creating a bidirectional relationship between sleep and hormone levels. Of particular concern is the increased risk of sleep apnea in men with low testosterone. Sleep apnea, characterized by repeated pauses in breathing during sleep, can have serious health consequences, including increased risk of cardiovascular disease and cognitive impairment. The relationship between sleep apnea and low testosterone is complex, as sleep apnea can itself lead to lower testosterone levels, creating a vicious cycle that can be challenging to break without addressing both issues simultaneously. The cardiovascular implications of low testosterone are an area of intensive research and growing concern. Testosterone plays a role in maintaining healthy blood vessels, promoting the production of nitric oxide, which helps blood vessels dilate and improves blood flow. When testosterone levels are low, vascular health can be compromised, leading to an increased risk of atherosclerosis, the buildup of plaque in the arteries. Moreover, low testosterone is associated with several risk factors for cardiovascular disease, including increased body fat, insulin resistance, and unfavorable lipid profiles. Some studies have suggested that men with low testosterone may have an increased risk of cardiovascular events such as heart attacks and strokes, although the exact nature of this relationship is still being studied. It's important to note that the relationship between testosterone and cardiovascular health is complex. While low testosterone is associated with increased cardiovascular risk, some studies have raised concerns about the potential cardiovascular effects of testosterone replacement therapy, particularly in older men or those with pre-existing heart conditions. This underscores the need for individualized assessment and careful monitoring when considering treatment for low testosterone. The impact of low testosterone on energy levels and overall vitality cannot be overstated. Many men with this condition describe a profound and persistent fatigue that affects every aspect of their lives. This isn't the kind of tiredness that's relieved by a good night's sleep. It's a deep-seated lack of energy that can make even simple tasks feel overwhelming. This chronic fatigue can have far-reaching consequences. It can affect work performance, leading to decreased productivity and potentially impacting career progression. It can strain relationships, as men may lack the energy to engage fully in family life or social activities. The fatigue can also make it difficult to maintain a regular exercise routine, which is crucial for overall health and can help naturally boost testosterone levels. The cumulative effect of these various impacts can be a significant decrease in overall quality of life. Men with low testosterone often report a diminished sense of well-being and a lack of enjoyment in activities they once found pleasurable. This can lead to a sense of loss and mourning for their former selves, adding an emotional burden to the physical effects of the condition. It's crucial to recognize that the effects of low testosterone can vary widely between individuals. Some men may experience severe symptoms with only slightly low testosterone levels, while others might have very low levels but fewer noticeable symptoms. This variability underscores the importance of comprehensive evaluation that considers both laboratory values and clinical symptoms. Age is an important factor to consider when discussing low testosterone. While testosterone levels naturally decline with age, the rate and extent of this decline vary significantly between individuals. What's considered normal testosterone levels can change throughout a man's life, and the threshold for what's considered low may be different for a 30-year-old compared to a 70-year-old. This highlights the need for individualized assessment and treatment plans. The diagnosis of insufficient testosterone isn't always straightforward. Testosterone levels can vacillate throughout the day, with levels typically highest in the morning. This means that timing of blood tests can be crucial for accurate diagnosis. Additionally, there are various forms of testosterone in the blood, including total testosterone and free testosterone, which is not bound to proteins and is considered the active form. Assessing both, along with related hormones like luteinizing hormone and follicle-stimulating hormone, can provide a more comprehensive picture of a man's hormonal health. Treatment for insufficient testosterone, while often effective, requires careful consideration. Testosterone replacement therapy can mitigate many of the symptoms associated with low testosterone, but it's not without risks. Potential side effects can include acne, sleep apnea, enlarged prostate, and alterations in red blood cell counts. There's also ongoing research into the long-term effects of testosterone therapy on cardiovascular health and prostate cancer risk. This underscores the necessity of thorough evaluation and ongoing monitoring for men undergoing treatment. It's worth noting that testosterone replacement therapy isn't the only approach to managing insufficient testosterone. Lifestyle modifications can play a significant role in naturally enhancing testosterone levels. Regular exercise, particularly resistance training, has been shown to increase testosterone production. A balanced diet rich in nutrients like zinc and vitamin D can support hormonal health. Stress management techniques, including meditation and sufficient sleep, can also help optimize testosterone levels. The psychological impact of low testosterone treatment is an essential consideration. Many men report a significant improvement in mood, vitality, and overall sense of well-being once their testosterone levels are normalized. However, there can also be psychological challenges associated with treatment. Some men may struggle with the notion of requiring hormone replacement, viewing it as a sign of lost youth or masculinity. Others may have exaggerated expectations about the effects of treatment, leading to disappointment if results aren't as dramatic or rapid as anticipated. This highlights the significance of comprehensive care that addresses both the physical and psychological aspects of low testosterone. In conclusion, the devastating impacts of low testosterone on men's health are far-reaching and complex, impacting virtually every aspect of physical, mental, and emotional well-being. From sexual function and body composition to cardiovascular health and cognitive performance, the consequences of this hormonal imbalance can substantially diminish quality of life and increase long-term health risks. Recognizing the signs of low testosterone and seeking appropriate medical advice is crucial for maintaining overall health and well-being. With proper diagnosis and a comprehensive treatment approach that may include both medical interventions and lifestyle modifications, many of the negative effects of low testosterone can be mitigated or reversed. As our understanding of hormonal health continues to evolve, the importance of maintaining optimal testosterone levels throughout a man's life becomes increasingly apparent, underscoring the need for awareness, regular health screenings, and proactive management of this crucial aspect of male health. Ultimately, addressing low testosterone isn't just about restoring a number on a lab test. It's about improving overall quality of life, preserving long-term health, and enabling men to live their lives to the utmost. As research in this field continues to advance, we can aspire for even better understanding and more targeted, effective treatments for this significant health issue.
Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.